Slayers, and welcome to another episode of She Slays the Day podcast. I am your host, Dr. Lauryn Brunslick, and I'm glad you're here. The thought came across my mind the other day that, to me, this is like an ongoing conversation, and everyone who is listening, right now, has been with me for 105 episodes, and they know my personality and my story and accept me and all my flaws and quirks. And then I realized as I found a new podcast and didn't go to episode 1, I started on episode 90 something, and I was like, oh shoot, that's what people do to this podcast. And we just throw them to the wolves with no background information. And they're just like, this chick is crazy. There's a progression. If this is your first episode, welcome to the shit show. No, just kidding. Kind of, not really. But there's a natural progression that we've all been on. So I think you'll like today's episode, whether you're brand new or not. But if you are brand new, then before we actually start talking about anything meaningful, I tend to fill everyone in on funny stories that are happening in my life. So, okay. So I have one for you today. So my daughter, who is 9, started playing soccer a couple months ago. Prior to this, we haven't really done any big organized sport. And I don't know what organized sports are like for other parents at 9 years old, but soccer is a huge thing, of gathering of people, because a lot of times, or at least in our town, there's 6 soccer fields all right by each other. So when there's the youth soccer 2 or 3 months, our town's only 9,000 people, but I feel because you have surrounding areas, I would not be surprised if there are 700 to 1,000 humans here. Okay, so including at the soccer fields, children, adults, refs, yada, yada, yada. There's a ton of people, a ton. So living in a town of 9,000 people where I've been in practice for 10 and a half years. And, okay, so for students, we're going to take a little side note. So there's something called PVA, right? So Kirby hates this stat. I understand why he hates it. It's your patient visit average, right? This is for how long does the average patient stick around. Now, he hates it because if you do it on a weekly or monthly basis, you're super penalized for getting new patients. If you can have a high PVA for a month if you had 0 new patients, versus if you had 20 new patients and actually saw more people, you would have a lower PVA. Anyway, so anytime that we've talked about PVA in our clinic, we only do it over the course of a year. And for the first, 5 years, it was around 30 something, and then it jumped up. Now it's in the high 60s, low 70s, which I'm not saying to impress anyone or whatever. It's just what it is. I wish it was higher. But so the average for a chiropractor is 8 to 12, kind of depending on stuff, okay? So let's use our brains here. Let's use my PVA. So I've been in practice for 10 and a half years. My PVA is, let's say, 65. That means that after 65 adjustments, people tend to fall off care. So can you imagine me, somebody who deals with major rejection issues, anytime, if I haven't talked about this on the podcast, anytime someone stops coming to me, there are 3 categories of people in my life. People, and this is all family and friends. People who don't do chiropractic yet and are opportunities, and are sometimes frustrating where I'm I don't understand. Why don't you do it? People who used to get chiropractic and people who currently get chiropractic. Now, if you currently get chiropractic, you get a pass even if you don't come to me, because I'm okay. Unless you left me to go to another chiropractor. Well, unless I understand, okay, they were a better fit. But for the most part, if you go to a chiropractor, I'm all right, I am glad you're getting chiropractic. If you don't go to a chiropractor, I'm okay, you just haven't had the right opportunity. But if you quit me, you're dead to me. I'm working on it, okay? That's not a healthy relationship with people because people should feel like, right? Like if my mechanic was secretly hating me because I stopped getting my oil changed there 5 years ago, I'd be like, oh, dude, sorry. It was easier because this one's over here. So it's unhealthy. You should not have this relationship with people who quit your services. But I do. I'm working on it. So there's like a whole like name for like people, like everybody deals with rejection, but like some people really deal with rejection worse. Funny story, it tends to be people with ADD that have the most like emotional like anger, and they just like want to take vengeance against people. Again, I'm in therapy. So back to the soccer fields, right? So for the last like 8 weeks, I have to go to the soccer field where there are just hundreds and hundreds of people. We live in a small town. I would say at least 30% of these people I know, and they fall into one of 3 categories. Like, why haven't you started chiropractic care with me yet? Why did you stop? And oh, hey, I'm so happy to see you here. Like they're a patient and like they bring me joy. But like a majority of these 1,000 people are not those people, right? That's just like how numbers shake out. So walking my youngest, who's not playing soccer, like from one field over to the bathroom is like just like this walk of shame where I'm just walking and just like, oh, hey, oh, hey, oh, hey. And it's just like, you don't come to me anymore. You don't come to me anymore. Why haven't you been back? Why did you quit? Like, where have you been? It's terrible, you guys. It's been therapy in itself of like having to be like, listen, people, I actually ran into like somebody stopped me and talk to me because as the introvert I am, I don't want to talk to you if you quit care from me. Like maybe that's not an introvert. Maybe that's just back to the terrible person thing. So like small talk with someone, like to me, it's just, I might as well have a neon sign on my forehead. I'm mad at you that you don't get adjusted by me anymore. But anyway, so someone stopped me and they're like, how are you? And I'm like, so good. And they're like, how's your new clinic? And I'm like, it's great. You should really come see it sometime. And they made just like a really sweet comment. They're like, oh my gosh, we have been meaning to get in, but life has just been so crazy with COVID. And then, like they explained, and not that they even needed to explain. But then my brain was like, oh, put myself in somebody else's shoes and like that life is not this egocentric, everybody is thinking about whether they like me or hate me, and that people just have shit going on and they're just living out their life to the best of their capability, and I should maybe stop taking things so personal. Whatever. It's a work in progress. So, okay. So today's episode it's a very chiropractic specific one. That doesn't mean that if you're an entrepreneur, you can't benefit from this, but we're going to be talking about my day 1 procedures, more specifically, why we don't adjust on day 1. We're going to get into that in a minute. You know what I realized the other day? So I don't know what I was doing, nothing important, scrolling Instagram, watching TV. And I was thinking about like, oh, I have to record a podcast episode. And I'm like, what number are we on? And I was like, oh man, when will our 2-year anniversary be? And so I had to do the math of like, okay, so there's 56 weeks in a year. So 56 times 2. And I was like, oh, that's coming up. So we're about to get to our 2-year anniversary. And that is just crazy to me. And I'm just super excited. And I don't want to forget about it though. So it reminds me of like, so my youngest, Ty, so I was giving her back way when she was a baby. I'm giving her a bath, and she was at the age where like she still, couldn't take a bath by herself. And I'm just like looking at her and thinking how much I love her. And I'm thinking, oh my gosh, I can't believe, like, what's it gonna feel like when my youngest, because we had decided we were gonna be done having kids after 2, like, what's it gonna be like when my last baby is 1 year old? And then I realized, oh shit, she's 14 months. We had a birthday party 2 months ago. I already went through that. So I'm trying to anticipate the birthday of the podcast so I don't go, oh, you guys, I forgot and whatever. But yeah, that's what kind of, welcome to the shit show, everyone. All right, so today's listener highlight. So the question in the highlight, because somebody wrote in the question, is actually the same person, but I'm going to read the highlight first, and then we'll go into the question. So this is from B. Boyer, and she says, your podcasts make me feel as if I'm sitting in the room with you having a conversation. That's what I love about it. Thank you for creating this amazing podcast to bring chiropractors together and get everyone talking. You're an inspiration to us future women chiropractors. Thank you so much, B. Boyer. That's a lot of weight to feel like I am inspiring the next generation, but it's okay. Some days I feel like, yes, I got this. I got this, guys. Follow me. And then other days I'm like, nobody listen to what I'm saying. I don't know what's going on. I have no idea. I can't even handle my own life. But here we are together. So let's read the question now that B. Boyer sends in. So it says, Dear Dr. Lauryn, I have been listening to your podcast for a little while now, and in one of your episodes, you talked about selling the care plan. How exactly do you do a first new patient visit? So many times I hear doctors saying that they never adjust on the first visit. However, I don't really see how you can't adjust on the first visit, especially if your patient is in pain. I'm currently in a clinic rotation at a chiropractic school, and we typically adjust on the first encounter. I feel like, did I say encounter? Encounter. I can't read. I feel like there's a bit of a disconnect between clinic and the real world. Yeah, you can say that again, Miss Boyer. After graduation, I'm planning to open a clinic with a friend, and we're trying to determine how we want our office to run. Do you recommend not adjusting on the first visit? And if so, how do you go about doing that? Oh, girl, I love this question so much. First, let's address that, yes, school, there's so many different opinions. So like, I agree that in the school's world, they may decide that it's best for you just to adjust. And, I get that. But yes, there is a big disconnect between clinic and the real world. So let's pray and then let's dig into this because I love it so much. Dear God, thank you so much for students sending in questions. Thank you so much for doctors sending in questions. I love that you have filled me with this passion and inspiration to help teach and lead and guide and, dare I say, mentor other female chiropractors. Help me anytime that I am feeling these feelings, and everyone listening who are in this situation of leadership and guiding others. Like, imposter syndrome sets in. We all know it, and know that like you have placed a seed of leadership in so many different women, and help us continue to evolve. And steel sharpens steel. So like, as we see these opportunities that are super stressful and they create imposter syndrome, remind us that you have given us that spiritual gift of being a good mentor, and just the fact that we're any of us who are aware of our flaws and want to work through them, like that is beautiful. Be with all the students who are looking to set up, help anyone listening, and help them put today's thing through a filter of whether this works for them. There are so many different ways of practice, and each one is going to work a little different for everyone. So help them take everything I'm going to say today, put it through a filter of, I'll take some of this, not that, this will work for me and not that. In your name we pray, amen. Okay, so there's a couple prefaces that I need you to hear before we jump into today, so I don't come across like a cold-hearted bitch. First of all, the number one, so I used to think, I'll get into like what my systems used to be, but I did adjust for years on the first visit. And I thought that it was a power move, a flex move, to not adjust on day one. And that's why I didn't really look into it. So where I am now in my thinking is that I truly believe in lifestyle chiropractic. I am a lifestyle chiropractic clinic person, doctor. That doesn't mean that people don't come in pain, and we'll get into that, but I believe that 100% of humans with a spine would be better off being checked once a week, sometimes more, for the rest of their life. Okay, I said it. I'm sorry if I come off crazy, but I have no intention of giving someone exercises so they don't, quote unquote, need chiropractic anymore. Like, sure, I'll give you exercises so you're not in pain, but you still need to be checked because I'm talking about brain-body connection here, people. So that's the type of chiropractor I am. Still listen, even if you're not, because I think you can get that. So I believe that sometimes it's like tough love. Okay, so I truly believe that not adjusting on the day one is the best thing for the patient because of the big picture. There's other reasons too. But like, I am not doing this for me to benefit financially or trick anyone into anything. Now, I will say that there are many side benefits to not adjusting that do benefit me. And throughout today's conversation, I may be a little brash. Know that it comes, I'm joking, well, not joking, but like there are some selfish things that are really, really great, but truly it does come down to this is what I've decided is the best thing for our patients to get the best care from me. No judgment also to anyone who adjusts on day one, who does systems and procedures different than me, who listens to this and goes, good for you, not for me. I don't have any judgment to anybody who adjusts on day one. At all. Like, you do you, boo. I feel like there was another preface. Maybe it was along the lines that, like, we're not a PI rehab pain clinic. Our ideal patient is, most of them come for pain, but they think they're only there for pain, but they've got so much more stuff that we can help with. So I will start by kind of saying what my day one used to be. So I used to be in network with every single insurance company that I could be in network with. And my day one included, let's see, I have to think here, filling out paperwork. And then they would come back and I would talk to them about their paperwork. And then I would do kind of just like range of motion, some orthopedic tests. I have to really think. And then I would go, okay, I think I might have like grabbed a Merrick chart and circled some vertebrae that were out of alignment, and said like, these are, what's contributing to your pain, yada, yada. It's not going to go away overnight. I'm thinking that you're going to need 3 times a week for a couple weeks, then 2 times a week for a couple weeks, then 1 time a week for a couple weeks. We'll call you, or we would have called their insurance. So while the patient's filling out paperwork, we would have called their insurance. So I would know, so maybe after the orthopedic tests, I might run out, check with my CA, have we gotten the fax from their insurance? So then I could be like, okay, so we're looking at a handful of visits over the next few weeks. You have a $20 copay, so we'll just collect that every time we see you. Any questions? Most of the time they'd be like, nope. And then they would lay down. I would adjust them. I'd say okay, you might be a little sore. Just put some ice on it. I'll see you again. Why don't you plan on 2 more visits this week? That was it. Okay. Again, no shame, no judgment, totally fine. Here's some of the problems that would arise with that. One, I had to switch from doctor mode into salesman mode pretty quickly. On the flip of a coin, something like that. You could flip a hat. So I would have to go from, okay, what is wrong with this person? And yes, a lot of times, if you're only dealing with pain, it is a pretty small bucket of things. Rib out, rotator cuff, migraine, hormonal, C1, a cervicogenic headache, low back disc, spasm, psoas, there's only so many things when you're looking at physical stuff, and I could figure that out. I had that wasn't an issue. Okay, assess, what's my primary diagnosis? I could figure that out quickly. But then you had to switch to communication. And some of you might have cringed when I said I switched from doctor to salesman. But you know what? Everybody's a freaking salesman unless you work in a setting where you have no investment in whether they choose what you do or not. We can still care for them and know this is the best thing for them, but people need to be sold. So anyway, so then all right, I have my primary diagnosis, great. So I'm gonna then communicate to them right now. Oh, you've never been to a chiropractor? Well, here, have you ever seen this chart? We call it a Merrick chart. No? Okay, well, I'm starting to circle things on it. And then, so I need to communicate what's wrong with them. Then I need to, in that moment, guess, like, based on what? Orthopedic test? Based on my gut instinct of how many visits it's going to take. And for most people, you can kind of guess, like, 12 visits, pain is going to go away, or like be greatly diminished. And then I had to also communicate how much it was going to cost. If you do adjust on day one, I do recommend, like, surprises are not fun when patients are like, wait, you never told me how much it was going to be this much. So it was a lot. So then let's say you pull it off. You adjust them on day one. What are the outcomes of adjusting with the first adjustment, right? So the first adjustment, there are 3 outcomes that can happen. 1, it got better. You fixed it. I don't need all those visits. She's amazing. Thank you so much. Let me know what I owe you when you process my insurance for day 1. Now, does everybody that happen? No, but it is a possible outcome of, like, oh my gosh, miracle adjustment, I have 0 pain. Like, okay, we all know that's coming back, right? Like, all of us know, whether you're a student or even just a layperson listening, you know that there is no magical pill for pain that's been around for 6 months. One adjustment's not going to do that, right? Okay. So, but it may have thrown a Band-Aid on it. They'll call in a year or a month or 6 months when it comes back worse. Option 2 is you made it no difference. And now, granted, you'll hear me out here. So you made it better. You didn't do anything. The adjustment did nothing at all. Or 3, you made it worse. Air quotes, worse. Okay, not actually worse, but they're in pain more. You better hope that while you were frantically figuring out what is their primary diagnosis, have we heard back from Blue Cross Blue Shield yet if their deductibles met? How am I going to communicate chiropractic effectively? And how many visits they're going to need? You better hope you also did a really good job of explaining that you will need more than one adjustment because that's how neurology works. It's okay if it doesn't move on day 1, and or you don't feel any improvement on day 1, here's why. And sometimes in the process of starting care, you can be more sore and it can feel like we made things worse, but here's what's going on in that scenario. Also, hopefully by now you're going like, wow, that's a lot. That's a lot, Lauryn. That's a lot for you to manage as the chiropractor who does this. Now put yourself in the shoes of a new patient who's never been to a chiropractor before, is wondering if, like, they need to have surgery because their friend who had sciatica had surgery, or they're getting migraines and, like, do I need to get an MRI because maybe I have a tumor? Like, put all that fear and newness and pretend that they're actually able to listen to you 100% and remember everything you said and hear it. If you have a patient who's in pain, they're so not quite there with you, okay? Like, even if somebody's not in severe pain, they're distracted. Everybody's got a little bit of, like, ADHD, and so they're like, that's a cool colored wall. I should paint my kitchen that color. And, like, oh, they said my deductible's not met? That's weird. We were just in ER for my kid's broken foot last week. Why isn't my deductible met? I should call when I get home. Like, right? We're busy. We're thinking and we're not listening as you're explaining that the first chiropractic adjustment brought somebody's hearing back. So that used to be my day 1s. This is why back then my PVA, as I said in the beginning, patient visit average, was in the 30s. And that is still impressive for a chiropractor to be in the 30s. That's 3 times the national average. I think I said this already, but so for the longest time, I went on thinking that not adjusting on day one was a power move because I know their right SI is what is causing them pain. Not adjusting their right SI that is causing them pain is pretending that I don't know what vertebrae to adjust. And then I don't know where everything kind of started to fall into place. I don't know. I went through this metamorphosis. Oh, it was getting out of network with insurance, blah, 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 where I became more subluxation based. And I realized that if I am looking to deliver a quick fix, oh gosh, please don't get shame or judgment on this, because I'm probably not going to say it as eloquently as it should. But I realized that it's not about whether they just need their right SI cracked or not. That is not the big picture of chiropractic. In my opinion, IMO people, IMO. In my mind, yes, can I adjust someone on day one? Is it helping them or me communicate the big picture of chiropractic and how it got to this point in the first place? And that as soon as that, I am giving them the tip of the iceberg by adjusting that right SI and making it that simple, because I am not talking about, oh, you want to get pregnant? Well, guess what? This vertebrae here that's contributing to your pain, could you go into all that on day one? You can, sure. But let me paint what my day one is now. And you can just decide, for all of you who are still with me in this, yeah, I want the big picture. I want those patients. I want people. Let me just paint a picture of what it is now. So first and foremost, it starts with the new patient phone call. You have to tell them they're not going to get adjusted. Otherwise, yes, you're gonna have a lot of pissed off people. And even if they're not pissed off, they're annoyed. They may be oh, I'm not getting adjusted today. Okay. Because they're viewing you like urgent care. And what happens when you go to urgent care? You get your medication that day, right? You don't make people come back to well, let me look at your lab work and actually see if it is a bacterial infection or if it's viral. And then I'll let you, no. We go in, we get an immediate gratification. So you need to kind of start the script from the get-go of letting them know, in this clinic, we rarely adjust on day one. It will ultimately be up to the doctor, but day one is a discovery day where we're going to sit down. We are going to do a thorough examination of what is going on. It's going to include X, Y, Z, whatever you're doing in your clinic. And then that'll be it for that day. Then what we'll do is, they schedule day one and day two on the phone, is we're going to have you, then on your second day, the doctors will have had time to discuss, to look at your results and put together a custom care plan that's specific to what you have going on. On that second day, there is a ton of information. They are going to communicate everything that they found from the first day, what's going on, why it happened, how long it's going to take, and what the cost will be. If you choose to start care, then on that day, you will get your first adjustment. Okay? You don't need to use that script. You can use whatever script you want that works for your clinic. But in ours, we don't go too in depth. We're not too apologetic about it. We're just this is how we roll, people. And I don't know. I should have asked my CAs, how many people care? Here's why I like it. Now, again, when I said, this is one of those things that benefits me, is for the people who are looking for a one and done adjustment. They say no. Those people go, no, I need to get adjusted today. And it's okay, give us a call, go ahead, call around, let us know if you need us. It took us a while to emotionally get to that place where we were okay with that outcome, because I promise you it will happen. And I don't know how much it'll happen, but it will happen, where the people who wanted to just get cracked and let you know if they thought they need a second adjustment, let you know whether they think they should come back again, and how many times they think they should come back, they are going to say no thank you and keep calling around. And God bless them, they're not your people right now. Okay? They're not your people. You're not their people. And that's okay. Like, I guarantee you that there are chiropractors near them that they're willing to drive to that will do that for them. No judgment on them, no judgment on the chiropractor, no judgment on the patient. It's just not what I'm selling right now. That is not the big picture chiropractic that I want. Now, most people are probably a little annoyed that they're not going to start getting relief right away. But most people are like, okay, sounds good. So when will I get adjusted? You'll get adjusted at your second visit as long as you start the care plan. Okay, like, all right, great. So now here's what our day 1 looks like. And we're not going to have time to talk about day 2 procedures. If y'all want to hear that, somebody's going to have to send in a question because I don't think I have a question asking about like day 2 stuff. So here's what happens now. They've gotten their paperwork. They've filled out their paperwork ahead of time. We do electronic paperwork. And they come. They are greeted on their paperwork. So we also tell them that we're a cash-based clinic. And in our paperwork, it literally says that we are a cash-based clinic. Are you going to require documentation to submit to insurance on your own? Yes or no? So we kind of will see on their paperwork whether they plan on submitting or not. It's just helpful information. I don't know. I like it. And then they come in. We take them to a room. They watch a video. Man, you guys are going to wonder what the video it is. I don't even know if you can still get it. So this is like 5 years ago. If you know who I'm talking about, someone send me a DM so I can share with people. It's this cutie patootie, like 40-year-old-ish Australian, New Zealand accent guy. It's a 4.5-minute video that, in my opinion, is really well produced. It's very professional. It's to the point. There's good lighting. And it really is like a nice 4.5-minute summary of chiropractic. And like, yada, yada. He talks about how a heart attack, you don't have pain as the arteries are clogging and blah, blah, blah. And he's all cute about it. So they sit and watch this video, and our front desk says like, okay, while the doctor's reviewing your paperwork, we have this for you. She'll be in just a couple minutes. I pre-purchased the video like 5 years ago. I spent like $300 and own it now. And so we just play it on an iPad. I don't know if you can still buy it. So then, side note on that, it has come up multiple times of would it be better if we made our own video? First of all, you have to understand that for produced video content, the average cost is about $1,000 per minute. So if you're doing a 4-minute video, expect to spend at least $2,000 to $5,000 for that video. Also, now on us, we could have Kirby do it. It'd be like a nightmare for him. Like he'd have like 3 months where he's just like edited, or 2 months, I don't know, 2 weeks where he's editing like a crazy person and we're having to do all this lighting and stuff. But I like having it be someone else. I personally think it's great that it is someone, not me, telling them that chiropractic is good for them. Because I'm already going to tell them on day 2 all this stuff. So like in my brain, the way I think about it, it's really nice that they're like, oh, this person, I learned about this from this other person too. Not just like, am I going to a crazy witch doctor who is like telling like cult-like thing? And also, yes, it is kind of a cult, but it's all right. I'm here for it. So they watch this video, I come in, I talk to them. I don't talk to them for very long because our paperwork is really extensive, that like, I got all the, I'll ask clarifying questions. I'll do a little yada yada, feel a little posture, whatever. And then I say that like nonchalantly, like I'll do orthopedic tests, make sure they're not, needing to be referred to get an x-ray or something like that. We don't do x-rays in our clinic. That was a whole elective choice. Again, like, I'm not going to go on that tangent. So we do, and then after they're with me, I then take them over to get a nerve scan. What we use in our clinic is called the Insight CLA, Chiropractic Leadership Alliance, whatever, scans by David Fletcher. Game changer for our clinic. Now, we should do an entire episode on just them, but like, I'm not being paid to endorse them at all. Like, this is just truly was a game changer for our clinic. Absolutely contributed to being able to deliver 36, 48, 60 visit care plans to patients and them actually signing and staying through to the end. So yeah, like I said, if you want information, you can reach out. I'm not being paid to sell them. But hey, David, if you're listening, I would love to be paid to sell them. So I hand them off. Our CAs are trained on doing the scans. They do the scans. I'm done. So then that's what our day one is. And we're like, okay, bye. Like, they have not been adjusted. Now, if they are in a ton of pain, it kind of depends. So like, if they are having acute muscle spasms, I will do stim. I will go ahead and tell the front desk, you know what, they're in a ton of pain. I'll say like, when are they coming in next? So if they're like, oh, your schedule didn't allow for them to come in until next Tuesday, I'll be like, I'll look and I may say, you know what, call that person, see if they can come in a little earlier, have them come back this afternoon. Okay, like there is no rule that says it has to be that day two has to be on a different day. If we have someone who's in acute pain, we'll have them come in the morning for day one and then in the afternoon for day two. We will make it work. I will stay late if it's really that big of a deal. I will come in early if it's that big of a deal. I'll shorten my lunch. If I can't get them in that day or the next day, I may, honestly, if they're in a lot of pain, we get them in within 48 hours. I will also sometimes, this is pretty rare, okay? I'll have the front desk put some electric muscle stim on them. Just kind of, start that process for them. Obviously, that has to happen after the nerve scan. For those that don't have nerve scans, you're like, why is that obvious? Okay, it just has to be because stim activates the body so much that the nerve scans wouldn't be relevant. So yeah, I'll have the front desk do that. That's fine. But yeah, typically, if they're in that much pain, we just get them in as fast as possible. So, what is the end result of not adjusting them on day one? Well, hopefully, first and foremost, you can imagine that me, as the person, has a much more relaxed experience. Like, think about the black and white difference between all I have to do is come in, ask questions, do some tests, and wait for the nerve scan results. Now, this could be for anybody, you guys. Like, if you do posture screenings, if you do x-rays, you don't have to do a nerve scan to do this. There's all sorts of different things that you can do. You can just do some orthopedic tests and tell them, like, okay, so we don't have a one-size-fits-all clinic, so I'm going to take your findings that I found today and compare, and we'll hear from your insurance, and I'm going to put together a custom game plan based on what I found, and I'll go over it next time. So, but it is really nice when you can, like, allude to something like x-rays or like a posture screening or anything that you can be like, I'm going to study those results. I'm going to look at them and use my brain to figure out how long I think this is going to take and be able to communicate what's going on. So yeah, on day one, I get to just be the doctor. I don't need to be the fastest thinker in the world to figure out what is going on, how much is their insurance going to pay, how much, we don't do insurance, but like, if you take insurance, how many visits it's going to take. Now communicate it effectively and do it so they're going to say, yeah, like I don't have to do all that. I just first of all, I get the filter of quality people. So right off something, the patient is there electing to wait just a minute before they start. So it's not somebody who's going, oh, no, I know what I need. I just need to be cracked. Thank you. I love you. We are not your people. You are not ours. Goodbye. So a lot of the people who I sit across from on day one have already semi-committed to care by being just willing to be a little bit patient. And back to like people who are in pain. Okay, can I just tell you from a real world experience that most people who are in pain have been in pain for weeks, months, or even years, but they decided that now is the time that they're going to take care of it. Very few people who come to our clinic were completely fine and then are not fine. Maybe that's because of the filter. I don't know. But like, but what happens then, what's really nice, like that actually you may go, well, Lauryn, that's because you don't adjust them on day one, so you don't even get to see those people. Back pain's kind of boring to me. If you don't have something a little deeper, like if it's like, we're not gonna work on like sleep or like pooping or anxiety, if you were truly healthy as a clam up until this weekend, you had zero problems, 0, 0, 0, and you lifted a boulder and you bulged a disc, like, okay, would I take you on as a patient? Of course. But if you're like, no, I'm not willing to wait 24 or 48 hours, like I want this fixed ASAP, you probably weren't going to stick around with me. And do I think you deserve chiropractic care? Absolutely. But if I'm going to emotionally invest in like learning who you are, like I want at least the possibility that you're going to stick around past pain. That's just what I want. That's where I'm at in my career. So yes, I get to focus. I get to sit down with patients who they're not all quality, but they've at least kind of been willing to play along of like, all right, I know I'm not getting adjusted today. I'm willing to be patient. Okay. And I get to just be the doctor. I just get to gather information. And then, you guys, I get to go and sit for a minute and think about what does this patient uniquely need? How long do I actually think this patient is going to need care for? If I'm taking insurance, which I'm not, but you might be, how much have we heard back? What is their deductible? How many visits are covered? What does that mean for their bottom line paying me? I get to like know all that information, and then I get to sit down with the patient. They were overwhelmed by what's this nerve scan in this clinic, and wow, they do things weird here, and like this doctor is this, and she's wearing ripped jeans, and that's kind of weird. I've told you guys that somebody didn't commit care because I wore ripped jeans to day one, right? I wonder what was going on in her brain on day one. But anyways, so then day two, I get to start kind of fresh of like, they're not already overwhelmed. So to the maximum amount I can, their listening ears are going to be on. Okay, they're not already overwhelmed with all of this new stuff, and I get to educate. I get to educate however I choose to educate. Now, you don't have to be a lifestyle chiropractor to need to educate your patients, okay? Like, you may be the type of chiropractor who's gonna give a ton of supplements and rehab exercises and yada, yada. It's still, I would imagine, in order to get your patients to the finish line, it's helpful that their listening ears are on and you can fully focus on being educational and communicating that aspect to them. So another end result that I get is that I get fully committed ideal patients, or I don't. I get to have this line in the sand that says, if you want care at this clinic, and again, we're not talking about day two, so I don't say it like this. This is how things have to go. This is what is going on. Do you want it or don't you? And they commit or they don't. And I will tell you that with my process, we have like a very, 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 very high conversion. I can't speak for what exactly, it's like in the 95. Honestly, out of my last, I think I'm probably batting closer to 98% conversion. And I'm not saying 98% conversion to people saying yes that day. I'm saying to people saying yes and following through for 30, 24, 36, 48 visits. And then our conversion to wellness after that is in like the 85% plus. So again, are converting to lifetime? Obviously not. Like I said, our PVA is like around 70. So somewhere around 70 visits, people fall off. But like, well, and sometimes people fall off at 36. Sometimes people don't fall off and they're on visit 150, whatever. But we get people who at least make it to the finish line. In our clinic, it is rare they say no on day two, and it's even rarer that they quit before I told them they would be done. So if I sell someone a 36 visit care plan, I don't even know, you guys, how rare it is. It's super rare. Now, you guys, I'm jinxing myself up, and like for the next month, that's all I'm going to have is people falling off care. People don't fall off their active care plan. If I said 36 visits and they said, yep, they go 36 visits. They don't fall off around visit 9, where it just doesn't seem to be working that well. Like, no, they stick with it. And I literally had this conversation yesterday. Someone's getting their first care, like rescan, because we rescan at the end of each month for active care people of 3 times a week. And so she got her scan, and so she's a 3-month care plan that we told her. She's on adjustment 12, and I'm like, all right, so next visit we're going to be going over your scan and just kind of making sure everything's on the up and up and that you're right where you should be for your care plan. And she goes, I just feel like I should be better than I am right now. And I'll use a fake name. But I go, Karen, listen, I understand. But you gotta hear it from my standpoint that if I thought I was gonna fix you in 12 visits, I would not have sold you a 36 visit care plan. I expect that it's going to take 36 visits for you to feel amazing. And she goes, oh, well, that's a good point. Duh. I mean, like, what would have happened in a normal scenario with that patient if I would have just gone, okay, let's, here's what you got going on. Let's do 3 times a week for a little bit. They would have said, sure. They would have said yes to that first visit. But by the end of month 1, they'd have been like, this isn't working. I think I should be better than I am. Now, granted, Karen is actually substantially better than she was on day 1. She was just expecting miracle stuff. And she would have quit. And that is exactly why the average PVA is between 8 to 12, because that is where a patient who hasn't been told, like, listen, this is why it's going to take this long. And that's all super important information that happens in the day 2 visit of like, you got to listen, so all your table talk is referencing that day 2. Remember when we did this? Remember when we did that? And they're like, yes, you're right. Okay. But yeah, otherwise, if you just word vomited all over them day 1, and you're like, well, remember when I told you on day 1 that this would probably take, more than a couple weeks? They're like, no, I don't remember shit. I don't remember anything. I remember I was in a lot of pain and I was just excited, but kind of nervous to get adjusted and wondering how much this was going to cost me. So the third, kind of end result besides quality people, me being able to stay in doctor mode, fully committed quality people, is the follow through. Like I just literally said, so I won't repeat it, but they stick with it. They really do stick with it. And I do believe that we would not have the follow through if we adjusted on day 1. So I believe, could I crack them on day 1? Could I adjust them? Could I, I should be kinder. That's not nice to use crack. Could I give an adjustment, on day 1? Yes. Do I think that as many people would cross the finish line? And in our clinic, crossing the finish line is more than just yeah, my sciatic pain went away. It is holy cow, I haven't had to use my inhaler since the 3rd week I started care. I am sleeping better. I have more energy. So when I say that, I believe that the best thing for them is to not get adjusted on day 1. Wait 24 to 48 hours so I can sell you. And I'm not afraid to use that 4-letter word of sell you what the version of life you don't even know you freaking want, because it's not on you. You are busy. You are overstimulated and exhausted, and you poor thing, you thought that I could only help you with headaches, and you don't even think you have time to try and think bigger picture about sleep. Doesn't everyone sleep like shit? Doesn't everyone take a sleep aid? Doesn't everyone need an allergy medication all year long? Doesn't everyone get sick all the time? Isn't everyone too exhausted? Isn't everyone too sore in their low back to lift their kid out of bed in the morning. I'm just here for headaches because like I'm at my breaking point and I finally made time to make this appointment. Yeah, it's not on them to think bigger for their life. It's on you. That is what you signed up for if you are a subluxation-based doc. Now, granted, again, pain docs, I even say to you, like, think bigger. If you've got a 35-year-old who's got a disc issue, think about what is best for them when they're 55. Think long term, think big picture, even if you're just thinking about their pain and you're only thinking about their disc, that's okay. Like, whatever, you do you, boo. But like, I challenge you, are you thinking with the biggest picture possible for that patient? Are you doing it for them because they're tired and they're in pain and they came to you because you're different? So think different. You would never go to an orthodontist and get braces on that day one, right? You would never go to a surgeon and be like, all right, I'm pretty sure I know what's going on. Let's cut. And I guarantee you, like, surgeons know. They're like, oh yeah, we're going to go in there. Here's what I'm going to do. I'm going to clean up that scar tissue. Let's just do that now. Like, no. And is it being a little overly dramatic comparing surgery to chiropractic? Maybe. But like, let's go back to braces. Okay, braces are a freaking commitment, financially and time-wise. Like, they deserve to know what they're getting into. This is how long it's going to take. This is what it's going to cost. But here is what you're going to get in the end, and it's worth it. So you might have to think a little bigger picture. You might have to care a little more than they do at this moment. It's okay. You don't need to sell them. You don't need to get them to commit to lifelong care on day 2. But, you can get them to commit to the next 3 months. And over that time, you can shift. And even at the end of 3 months, when they graduate into wellness care, you don't need them to commit to lifelong wellness. You're just getting them to commit to their next re-exam. And it's okay that you're dating these patients, but there is a way to set up that day 1, day 2, where they do marry chiropractic, right? Where they do eventually go, oh yeah, I'm getting adjusted at a wellness frequency that works for their life for the rest of my life. And it just takes a lot of pressure off you when you're not hoping that that's going to happen on day 1. Okay, here you go. Day 1, people. I definitely alluded to a lot of systems and procedures on day 2. We probably should do an episode. If you think that it would be valuable to hear a day 2 systems and procedures, do me a favor. Screenshot this episode, share it on social media, tag me, and let me know you want to hear the part 2 to this conversation. If you have not left a review before, I would really love if you would. It helps the podcast get seen by other chiropractors, and really helps, us build our little army of female chiropractors and males. Okay, if you guys are listening, that's fine. But who are like out there to change the world and do things a little different than we were told in school we had to do to be successful. And we're okay with being a little weird and being a little bit of a cult. It's okay. But we're just kind of finding our people. And so it helps your reviews help those like-minded people find the podcast. So until next week, She Slayers, I love you. I appreciate you. I am so sorry if you are having a hard time right now, but I am here for you. So I'll see you next week.